Before we start our procedure, we must introduce ourselves to our client or to our patient. Good afternoon, ma'am. I am Shampooing Pangilinan, your student nurse for today. After that, we must review the patient chart for any limitation movements of the patient. And after reviewing the patient chart, we must prepare the equipment to the bedside of the patient to save time and energy. We have alcohol, clean gloves, basin, warm water, and towels for comfort of the patient and privacy. And that's all. And after that, we must do hand hygiene. And after hand hygiene, we must wear clean gloves. After doing the hand hygiene and wear clean gloves, we must identify the patient using 3 identifiers, name, age, and birthday. We must first also check the patient chart. And for confirmation, we must ask them to state their identity. Ma'am, may I confirm your name?
Regina Gamora,
How old are you?
25,
Your birthday?
May 40.
After that, we must also check the wristband. May I also check the wristband, ma'am? Identifying the patient provides a correct patient and correct procedure to the patient. And after that, we must explain the procedure to ease the fear or anxiety of the patient. Ma'am, for today's procedure, I will bed bath you. Means I will be washing your body from head to toe. Is that okay with you? Okay. This ensures that it will clean your body and freshen up you. It will freshen up you. Okay. And after explaining the procedure, we must assess for the ability and as well as the hygiene preference of the patient. After that, we must do the provide privacy to our patient by closing the curtains, or if possible, we must close also the door to provide privacy of the patient. And after that, we must offer bedpan if they need to pee or defecate right now. Mom, I will offer you a bedpan. Are you urged to pee right now? No? In this time, the patient don't need to urinate or to defecate. After that, we must remove the gloves and do hand hygiene again. And dispose. And do hand hygiene. After doing the hand hygiene, we must adjust the bed in elbow height of the nurse to avoid the improper body mechanics of the nurse and to provide confidence to the nurse. Okay. After adjusting the bed to elbow height of the nurse, we must do again the hand hygiene and wear clean gloves again to prevent the spread of microorganisms and contamination. After doing hand hygiene and wear clean gloves, we must load the side rail to avoid the improper body mechanics, and after that, we must assist the patient to lie in his or her back. Ma'am, are you already comfortable in your position? Okay. And ask them if they are already comfortable. After that, loosen up the upper coat of the patient, But before we loosen up, remove the top side and put the bath blanket. First, the warmth of the patient and privacy. After that, loosen up the top covers and remove while the bath blanket is on the top. After that, we must also remove the patient gown Now I'll remove the patient ear gown. Assume that now I will remove. If the patient has IV line and not wearing with snap sleeves, remove gown from other arm and pass down to the tubing or the container and rehang back the container, and after that monitor the IV drip plate. And while we fill the basin with sufficient warm water, 110 Fahrenheit to 115 Fahrenheit only, we must pull the side rail up to ensure the safety of the patient, and check if the patient is already comfortable in this warm water. I want you to put your hands in this and check the temperature of the water. Is that okay with you? Okay. After wearing clean gloves again, we must fold, but first we must put the towel in warm water and squish. And after that, fold the washcloth like a mat on your hand so there's no loose, and to avoid the coldness in our patient and uncomfortable feeling. After folding, we must wash the patient's eyes. So, mom, I'm gonna wash your eyes now. Is that okay with you? And now, I'm gonna rinse the eye of our patient. One eye only. And from inner part to outer part. Inner part near the nose and out from to the outer part. And after that, rinse again to avoid debris, transferring debris from one eye to another. And fold again like a mat in your hand so there's no loose. Okay, and do and the exam from inner part to outer part. Okay. After cleaning the eye, we must rinse again our washcloth. After washing the face of the patient and from eyes to forehead, down to cheeks, nose, chin, ears, and neck of the patient. After that, I'm gonna wash her hand and arm and axilla. First, I'm gonna rinse the towel or washcloth. But first, I'm gonna put the patient arm underneath, like covered on the top of the patient towel, and gonna wash hands, arm, and axilla. And I'm gonna also put the basin and put the hands of the patient to remove the debris or dirt from her fingers. Okay. After that, I'm gonna dry her hand, patient hand. After that, and also do on the other side. After washing her hands, arm, and axilla, I'm gonna spread a towel across the patient's chest. sure it provides privacy to the patient and comfort. After that, lower the bath towel to the umbilical area of the patient. Make sure to provide privacy all the time and comfort the patient. Umbilical area. Umbilical. After putting the bath towel in the umbilical area of the patient, I'm gonna wash, rinse and dry the patient chest. Make sure also again to provide privacy and comfort the patient. And after that, pay attention to the folds of the patient under the breast to avoid the sources of odor and skin breakdown of the patient. That lower the bath blanket. And after that, I'm gonna wash, rinse, and dry the abdomen of the patient and pay attention again to the skin of the patient, skin folds of the patient. And make sure to dry it. But make sure that every procedure you must ask for the permission of the client and assure them before doing that procedure. And after that, return the bath blanket to its original position. Okay. Make sure to provide privacy. Now I'm gonna wash, rinse, and dry the leg of the patient from ankle to knee and knee to groin. Okay, make sure to expose only leg. Okay. And rinse. Eye. From knee to groin, make sure to provide privacy. Okay. Rinse and dry. Adjust again the bath blanket. And I'm gonna wash the foot of the patient. Wash, rinse, and dry to avoid sources of odor and dirt. After that, washing and rinsing and drying the foot to prevent infection and irritation to the patient. And after that, change the water or the washcloth to prevent chilling and maintain the patient comfort. After washing the foot of the patient of our client or our patient, I'm gonna change the water and washcloth to prevent further bacteria or dirt and prevents chilling and maintain the patient comfort. And after that, I'm gonna assist the patient to sideline position. But before that, I'm gonna do hand hygiene and wear clean gloves. After wearing clean gloves, assist the patient. Make sure that the side rail is up to prevent the fall of the patient and further accidents. Okay. And make sure to expose only the back and the buttocks of the patient. And wash, rinse, and dry, and observe for any redness or skin breakdown on the patient back or buttocks. Wash, rinse, and dry. After that, wash the buttocks, the patient. After that, dry, rinse and dry. And after that, if not indicated, you must do the back rub to the patient to make them relax and comfort, to provide relaxation and comfort to our patient. Now I'm gonna do back massage or back rub. Is that okay with you? Assume that I have oil. Raise the side rail. Okay. After doing that, I'm gonna put the patient back in a regular position. Okay. After that, I'm gonna make sure the side rail is up to prevent fall of the patient. And after that, I'm gonna refill the basin with clean water and discard towel and remove gloves and do the hand hygiene again. And wash the private area if the patient is comfortable for you to do that. And help the patient to put clean gown of the patient. Okay, make sure right there you see. Gonna put in your gown. Okay. And after that, discard the towel. And discard. After that, and discard also the clean gloves and do hand hygiene again. And ask them if they are already comfortable in their position. Already comfortable in your position, ma'am. Okay. After that, I'm gonna put up the side rail and load the bed to the lowest position. And make sure the pillow is 45 degrees or the level of the patient comfort. Make sure to dispose and discard our towel and perform hand hygiene to prevent the infection, transmission, and the contamination of the used equipments or materials.